And along the way there, you got connected with Walk the Talk America, which we've actually had one of the founders on the show a couple of years ago to discuss their efforts with not just suicide prevention, but also mental health treatment for gun owners and things of that nature, and trying to connect sort of the gun owning world with the mental health professional community. And so now you're working together with them on a fundraiser, right? Can you tell people a little bit about what exactly is going on there?
Yeah, I'm really excited to announce a fundraising challenge for Walk the Talk America. And our goal is to raise $100,000 between now and May 8th. And I'm personally donating $5,000, which will be used to match donations of $500 or less. And hopefully, right, we'll get to that $100,000 goal by May 8th. And so for those of you that aren't familiar with Walk the Talk America, they're focused on mental health and providing not only free mental health screenings for either gun owners or anybody who goes to their website at WTTA.org. You can take a free mental health screening, and if you need to get connected to mental health resources, Walk the Talk America helps accomplish that. The other big piece that WTTA or Walk the Talk America, one thing that they also work on is educating frontline mental health practitioners and helping them understand gun culture and Second Amendment concerns around losing your firearms. And so, there's this real dynamic of fear where if you go see a mental health practitioner, that person, can have the power to take away your firearms with questionable due process. And so what Walk the Talk America does is educate these mental health practitioners, help them understand gun owners' concerns, and make sure that our Second Amendment rights stay intact. So those who need mental health services can get them without fear of losing their constitutional rights.
Right. Can you talk a little bit more about that? What this $100,000 that you're trying to raise? What exactly is that going to go towards? Which programs at Walk the Talk America?
Yeah, the $100,000 that we raise will go to the general operations of Walk the Talk America and help them create more educational content. So one thing that's been was very cool to see about 3 years ago, I was in San Francisco where I live, and there was a mental health conference, right? So you had 150 mental health practitioners meeting for an educational conference. And there was a section where firearms industry professionals were educating and talking to mental health practitioners about guns, about gun culture, and some of the concerns that we have around, potentially losing your firearms if a mental health practitioner deems you to be, a concern, right, a threat to yourself or to others. And, these 150 mental health practitioners, right, that we're talking to Walk the Talk America. They were taking classes, right, continuing education classes that are put together by WTTA. These practitioners were telling us, wow, like there was such an incredible learning experience. That these mental health practitioners, they did not understand some of the sensitivities around talking about firearms with gun owners, and not to jump to conclusions, right? That just because you are having some mental health challenges and you happen to own a firearm, well, those aren't necessarily connected, right? Just because you own a firearm doesn't make you more likely to harm yourself or others, which is an incorrect assumption, right, that a lot of these mental health practitioners had. So that's just one example of how Walk the Talk America, right, is taking money that is raised by and helps them create more educational content and deliver these educational courses to the frontline mental health community.
Right. And so one of the things they'll do with the money that you're trying to raise is improve these programs that they have, improved this network that they're trying to build with mental health professionals, trying to sort of, I guess, enlighten them on how a lot of gun owners approach this issue, because I think you got at this point a little bit earlier, but one of the challenges there is that sometimes gun owners will skip out on taking like mental health resources or going to a physician, a psychiatrist or somebody like that out of fear that they're going to lose their firearms because of it, right?
Exactly right. And so Walk the Talk America is helping reduce the barriers to accessing mental health services and resources. And a big part of what Walk the Talk does is just help educate not just these frontline health practitioners, but also gun owners, right? And so there are ways that you can if you are having a mental health crisis, for example, there are practical things that we can do with our firearms, such as, hey, talk to a friend, right, or a family member, and you can ask them, hey, I'm going through a rough time. Would you mind temporarily would you mind temporarily holding on to my guns, right? And the idea there is to create some time and distance, right, away from any potential harmful items. And it's not just firearms, right? It's edged weapons, it's prescription medication, it's poisonous materials as well. I've been working in the suicide prevention space for about 10 years now, and I've learned a lot, and I continue to learn a lot about the space. And to be very frank, I came from a place where I always thought, oh, well, if somebody wants to take their own life, that there's not much that we can do about it, that we should, right, let people live their lives the way they want to live them and just sort of let it happen. But I've learned that for a lot of folks who want to take their lives, oftentimes it's something that if you can interrupt that thought, right, that the suicidal ideations, or if you can provide, right, the support that they need, that you can actually prevent a suicide from taking place. And just that simple fact, right, that we as individuals are very empowered, right, to help provide support for those of our friends, family, and coworkers, who are in need. And being a gun owner is a sort of another layer, another lens, right, to look at mental health. And so, I like to think that Americans, right, we all want to do the best thing, right, to do the right thing. And if somebody is struggling, this means for me is like we want to get that person help. And Walk the Talk America is doing incredible things, right, to encourage people to talk about any mental health challenges that they may have. And again, connecting people to those mental health resources. And then on the mental health, therapists, frontline, folks, make sure that they're able to adequately and effectively, right, provide treatment to those of us who may need those services.